Welcome back to Healthcare Consumerism Radio. This is your host, Brent, Macy, and going to talk a little bit about HSAs coming up, and we're trying to get Kevin on the line here, and he'll be joining us shortly. But what Kevin, just for the audience out there, Kevin is the executive director for the ABA HSA Council and a big proponent in the HSA world. Kevin works a lot up in D.C. and really has been one of the biggest proponent up there on health savings accounts and really working to get health savings accounts a part of the law. And so, one of the things that we've always discussed with Kevin is how can we help him and what he's doing to really focus on HSAs. Obviously, with healthcare consumerism, HSAs are a big piece of the puzzle, and it's, as we talk all the time, it's not the only piece of the puzzle, but it's a good driver that really allows your employee population to control their buying habits around healthcare. And so joining us right now on the program is Kevin, the executive director with the ABA HSA Council. Kevin, welcome to the program.
Thank you. Good morning. How are you today?
Doing well. How's everything in D.C.?
Well, it's chaotic, as you've seen from the radio. There is even less agreement than there usually is.
Oh, good grief. Well, it's almost to be expected up there sometimes. So how, in your world with HSAs, as we were telling the audience, how will, HSAs really prevail in the new world order is kind of what we want to talk about and kind of give our audience, give them the quick overview on the ABA HSA Council, and then we can kind of talk about where HSAs are going to sit moving forward in all these debates.
Sure. Let's start with something delicious, irony. There's a 10-year anniversary coming. That's January 1. The irony there, of course, is that's the effective date of the Affordable Care Act, but HSAs will have been a real live product for an entire decade by that moment. And what happens in the intervening 10 years to get us there is, to me, a fascinating story. It begins, and I've written about this a couple of times, so I don't want to bore the audience, but it begins, like all good Washington stories, in the basement of a prominent hotel. And in the basement of a prominent hotel, we visited with then Obama staffers, then McCain staffers, who came to tell the board of directors what their vision for health care reform was, and I think that's something that's contemporaneous to today's discussion. There was an effort on behalf of both parties to reform the system. And oddly enough, they looked a little alike in some respects. Exchanges, for example, were a Republican idea, one currently endorsed by Senator Rubio, who is also an HSA proponent. But the idea was that while we were going to be part of the Republican vision, we were certainly not going to be part of the Democratic vision. And oh, how times have changed. A bruising legislative battle later, and a bruising regulatory battle later, it turns out that because of the particular way the rules mix with the marketplace, HSAs didn't just survive the moment. They're actually the most affordable option out there, and they're thriving. Mm-hmm. There's a literal explosion in enrollment in HSAs, and this was anticipated about 2 years ago when we looked at all of the rules and concluded there's no way you're going to be able to order Americans to buy health insurance and not give them something affordable to buy.
Mm-hmm. Now, from a state standpoint, in the exchanges, are all states taking on HSAs and offering them through state exchanges? I know there was a question about California, but I think that worked itself out. Are HSAs available on all the state exchanges currently?
They're not, and there's a couple of reasons why that's the case. The first problem, though, is that when we wrote California's exchange, they didn't even know that they offered them. So let's just start in the general place where we understand that exchanges haven't had the opportunity to organize as effectively as they wanted to. And there has been less than total clarity by regulation here in Washington. And so there are some states that were unaware, for example, that the $2,000, $4,000 deductible limits on small group policies had been ameliorated by the Department of Health and Human Services, and so they could be offered on exchanges with greater deductibles than that if the net effect was a $2,000, $4,000 limit.
Mm-hmm. Hey, Kevin,
so, for example, a $5,000 deductible with a $1,000 buy-down is a perfectly reasonable design plan, according to Washington. But because that's one of those read between the lines issues, state attorneys general were reluctant to approve it for distribution in their state exchanges, and we expect to have that solved shortly.
Hey, Kevin, Doug. Good morning
Hey,
to you, buddy.
Good morning.
Look forward to seeing you in a couple months, by the way,
Can't
Forum,
wait to be there.
at the Forum West. Hey, public exchanges set aside. I mean, there's this, we see two things happen. First of all, we see a major look-in by the industry this fall on how is defined contribution and private exchange going to work. And if it does work, I think we're going to hear a giant sucking sound from a big number of employers. And I want to come back to you, get your perspective on HSAs there, because I see it very, very favorable. The other is, as you're talking about, I mean, in conversations I have every week across the country with a lot of employers and others, is that, I see exactly what you see. I see that full replacement HSA programs picking up great speed right now with a majority of the market. And I think you just affirmed that a minute ago. But how do you see defined contribution of private exchanges, and what other trends do you see going forward?
Well, these exchanges are nothing more than distribution mechanisms and pooling mechanisms. And so from the business perspective, if you're a consumer, even a corporate consumer, you just want to know where you can get the best mix of benefits for the right price. And then the risk managers come by and help you understand that you're probably going to want to pick something that the IRS has already considered a safe harbor, since they're going to be the regulator. And so to your point, that almost always turns up as an HSA-friendly discussion. Mm-hmm. I don't think there's going to be a new dogma here. I think there's going to be agnostic players where if they can do it in the public exchange, through private brokerage, or through private exchange, they will.
Yep.
Mm-hmm. Now, Kevin,
so the question becomes, what's the most efficient way to do it, and who has the most credible suite of products being offered? What's the inventory look like?
Now, Kevin, going back to kind of the debate between Obamacare, obviously there's a conversation going on up there around defunding Obamacare or delaying certain pieces of it. Will the effort around defunding Obamacare hurt HSAs, or however that political football kind of comes out?
We're not even part of that discussion, mostly because whether you fund the Affordable Care Act or not, what are you talking about funding? You're usually talking about funding subsidies. And so the question comes down to the issues you've seen on the front page. Will the individual mandate be suspended or not? And there's a couple of different ways the minority party's been approaching this. Obviously, the law is unpopular, and so Republicans are tapping into that displeasure. And it's key to find out, what is the displeasure about? Well, it comes down to price. It comes down to lack of choice. Mm-hmm. But, and this is an important but, from the policy perspective, if the Republicans were successful to defund this, what would replace it? Well, we have an answer to that question, and we hope the country is ready to hear. The Republican alternative embraces HSAs significantly. Mm-hmm. And it can play for almost all participants. We just have to be a little careful there. Now, as far as parliamentary maneuvering goes, I think the question is a different one, which is the seasoned leadership in the Republican Party knows full well what happens when the minority party tries to shutter the government. Mm-hmm. It happened in 1995, and there was a backlash in 1996. So the question is, do they want to let that happen again or not? I think the answer is going to be or not. I think the government's going to keep working, but I think they're going to require the majority party and the president to at least acknowledge that there needs to be delay until some of these fundamental questions about exchange operations and even eligibility questions have been answered. And they haven't been answered yet.
Now on the looking at the big picture, for all Americans out there, what do they really need to know about health savings accounts? I think, we had Devenir and their team on the program a couple of weeks ago, and they really talked about the number of deposits in health savings accounts has grown tremendously, but there still is kind of an education process out there. Would you agree?
It's enormous. People aren't sure what's going to happen to them, period, and I think that's the point. We got to change this country from a group of people that are waiting for something to happen to them to a group of people that are about to make something happen.
Right.
Once you make that transition, HSAs become easily understandable because you're in total control.
Mm-hmm.
So it comes around to, are you a saver or a spender? Are you a planner, or do you let things happen to you?
Mm-hmm.
And we need people to start making that transition quickly, because the exchanges don't work the way your employer works. No one's going to come and send you a memo and say, by the way, we signed you up. Is that okay with you?
Mm-hmm.
You're going to have to make choices. You're going to have to measure, and then you're going to have to act, because the penalties go up. I don't know if you gentlemen are aware, but a controversial, not really a study, it's a guide, was issued yesterday afternoon by Politico. But it's got a very nice summary of how the penalties respond, and they go up pretty dramatically year to year to year. And so tie that back to the debate in Congress. They want a 1-year suspension of the law, and so the government can be ready. The penalties go up year after year for not complying, and together that means we probably have a little more time to teach America what it is to save for your future. And that's the key component to pretty much life, but it's certainly the key component to HSAs. You have to know what you're spending. You have to be a good shopper. You have to make judgments about what's required and what isn't.
What are some of the, Kevin, we've got about a minute to go, so I'd like to give you time to kind of tie it up in a nice package for our audience. But and including that, what are some of the initiatives that the HSA Council is taking on to help the industry with what you just mentioned?
Well, the first thing we're doing is we're advertising,
mm-hmm.
and we have compliance resources here, and so we're helping banks understand how to distribute HSAs to their customers, make them aware that they have this facility. We're trying to help with the enrollment problem. There's a great many Americans, believe it or not, are still unaware, 3 days before it starts, that they've got to act.
Mm-hmm.
And so we have to help them understand that they've got to act, but we've got to give the people doing the distribution the tools they need to understand how these accounts work. And as you're both aware, the card technology that goes with these accounts is complex, not to the consumer, but to the industry.
Mm-hmm.
So those card technologies have to work perfectly. They do now. We need to make sure that that survives whatever the new rule changes are going to be as the government gets more familiar with how their exchanges operate. The other thing we need to do, and I think this is the last comment, I think we have under-discussed, if that's even a word, or we have avoided discussing to the extent that it's necessary, the gravity, the weight, the importance of the Internal Revenue Service, both as an Affordable Care Act regulator, but the fact that they set aside 3 safe harbors, and 2 of them are HSA plans. That is a deliberate act on the part of the government of the United States saying, if you have these 3 plans, we will get to you second or maybe even third in terms of looking at your performance, because we have experience regulating these plans and we trust you. That means these are probably the most attractive plans in the country.
Yeah.
Well, Kevin, thank you so much for joining us today on Healthcare Consumerism Radio. Hope you have a great weekend. And to the rest of our audience, stay tuned for the next segment of Healthcare Consumerism Radio.